Hey everybody, today we're talking a little bit more about the surgical treatment options for hallux rigidus. And there's quite a few, but really just depend on how deformed or how arthritic the joint is. You can see in this picture that it is quite advanced degeneration. So we may be looking at some of our later stage, but then it really comes into how active our patient is and how old they are and how quickly we want to return to activity. Because a lot of this will really come into play, particularly in our elderly patients that can't really afford that time, their downtime, where they may be deconditioning from some of the activity that they're undertaking. And so when we're starting to look at this hallux rigidus and at the lower end hallux limitus, which we talk about a bit more in another video, but we're really looking towards a cheilectomy, which is also known as a metatarsal arthroplasty. And we're basically taking the dorsal third of that metatarsal head and a little bit off the medial and lateral aspects of that metatarsal to make sure that we're opening up that joint. Now, depending on the level of deformity and arthritis, we may then also undertake a Moberg Osteotomy, which is like a dorsal wedge out of that proximal phalanx at the top, and making sure that that then opens up that joint a little bit more, allowing for a lot more of that dorsiflexion of that first metatarsophalangeal joint. Some people may also undertake or have undertaken an interposition arthroplasty, where we're putting some of the soft tissue, like the capsular tissue, in between that joint, and that basically acts as a fake cartilage, allowing it to have a bit more range of motion and decrease the pain associated as well. For those that are a little bit older and maybe not as active and wanting to get back on their feet a little bit quicker, that's where we may undertake a Keller Arthroplasty or a Phalanx Arthroplasty. Basically, we're removing that proximal phalanx base, and that's going to obviously free up the joint quite considerably and then allow that first metatarsophalangeal joint or big toe joint range of motion into the dorsiflexion area. And so it's something that we can undertake, but because it does lose a lot of the strength and the big toe becomes a little bit floppy, doesn't allow us to have a good propulsive phase through that first ray, we do need to consider our patients that we're undertaking this for. Now, for patients that are at late stage arthritis and hallux rigidus of the first metatarsophalangeal joint, similar to the picture that we've got here, that's where we may be undertaking an arthrodesis or fusion of the big toe joint. In these patients, it means that they are at the end stage, and we're really wanting to control the motion control the pain by stopping the motion completely. And this is where we're going to put a few screws and a plate in, likely, to make sure that that joint's not going to be of concern. Of course, after resection of any cartilage that are there. But these are the sort of go-to procedures that I'll look at when it comes to hallux rigidus. Hopefully you enjoyed this video. If so, please subscribe, look at some of our other videos and some of the conservative options and potentially when to get a second opinion. But for now, we'll see you in the next session and catch you then. Cheers.